Hi, and welcome to Disaster Relief of Illinois, IBSA Health and Safety portion of your disaster relief training. I'm Kathy Dudley. I'm a retired RN, and I am the Health and Safety Director for IBSA Disaster Relief. I have been doing disaster relief since 1989 when I went to Charleston when Hugo hit the East Coast, and I have gone as far west as Colorado, doing several disasters. I can't remember even from the first disaster that I went on that there hasn't been one that I haven't at least put a Band-Aid on somebody for some kind of an injury. The worst thing that ever happened was when I had to administer CPR to a fellow disaster relief member. A result of all of that, we decided that we needed to do more with health and safety and disaster relief, and so we have added this as a portion of our training. We're going to go over several things today that relate to health and safety for you and your team members during your deployment on a disaster. As you take the various classes, you will learn about safety issues specific to that ministry, whether it be chainsaw, cooking, flood, recovery, childcare, and so forth. Some of the things that you can do now to help keep updated before you ever called out is the preliminary paperwork. There's papers that you can download and print out and fill out, and one of them is the Illinois Disaster Relief Personal Information Sheet. That information sheet isn't to pry into your privacy, it's to help those who might be near you if you should happen to become ill or get hurt while you're out on disaster relief. We hope that doesn't happen, but in case it does, we need that information. It includes your health history, your allergies, and medication information. So you need to fill that out. Keep a copy of it with you. I keep my copy in a little plastic thing that I put my badge in around my neck. I give one to my disaster relief leader, my blue cap, and that way it's always with me should I go down. Keep a copy of it with you, and then take an extra copy when you go out, because you will be asked to fill one out at each site that you go to. Because if you are a diabetic, if you have epilepsy, heart conditions, lung conditions, blood thinners, EpiPen, inhalers, maybe you're on some new medication that hasn't gotten leveled out yet, those kinds of things the people around you need to know. If you're traveling with someone, let them know if you have an EpiPen and what your allergy is that would cause you to have to use the EpiPen, and also where your inhaler is or where you might find something for your diabetes. That's for your own safety, not to give information out that you might not want to give. Just remember that. The other thing that you need to have is your tetanus shot. Don't be Shane. Shane was a guy who stepped on a nail at a site and it went through his shoe into his foot, and he had not had a tetanus shot. So he had to go out and get a tetanus shot, and hopefully that it was going to work, and I think it did. He was fine. But that's the reason for that. You're going to be working in a lot of muck and dirt, and you need to have that tetanus shot. The other suggested shots and immunizations to get is a hepatitis A and hepatitis B, but you don't have to have those. We're also going to try to have a nurse on board at each call out with the teams, or at least someone who has some type of medical knowledge. The other thing you need to be sure and do is take your routine meds with you, enough for your stay, plus a few days just in case you get delayed somewhere along the way. Tylenol or Advil if you think you're going to have some aches and pains from all the work, or you have a headache. We will try to have some of that with us in our emergency kits, but just in case you want your own of whatever you like to take, I would take it with you. Buddy system is a good idea. Let that buddy know if there's any of those health problems that need to be shared, and your buddy can share theirs with you. That information is good if you have to call an EMT or if you have to be taken to the hospital. If you need any kind of special sleeping arrangements, don't be afraid to ask. We'll try to accommodate you, such as if somebody has bad snoring, wants a more quiet place to sleep, we will try to accommodate you, but they can't always be guaranteed. You may need to dress in layers for sleeping if you're staying where it's cool, or bring extra blankets. Even in the summertime, sometimes the AC can't be completely controlled to everybody's level, and you need to pile on an extra blanket. We'll show you some of the sleeping arrangements that we sometimes have. This is in a classroom, and there's cots, and then you have to bring your blankets and linens and your pillow that you'd like to sleep with. Or you can bring an air mattress if that's what you prefer to have. If we have shower trailers on board, we will have towels. I always go ahead and take a towel. It has some more of our sleeping arrangements, and you can see that the dining area is on the other end of the gym. This is in a gymnasium in Florida. And when we're in the gyms like this, most of the time the guys are the ones that are sleeping out there. And the restrooms at this particular site are over near where the eating area is. And so the ladies from down the hall in the other classrooms had to walk through that area to go to the restroom. There was a couple of occasions where we saw a few little whitey-tighties, and we don't need to see your whitey-tighties. So please be sure and go to the restroom or someplace to dress if you are sleeping in a gymnasium such as this. Here's another example of a bed, and this is an air mattress on the floor in a classroom, and you can tell it's a child's classroom. We have to rearrange the furniture in that classroom, and when we leave, we have to put the furniture back where it was if another team's not coming in right behind us, or if the church has to have the classroom for Sunday school. We have to stand our mattresses up on the side or fold up our cot a little bit. This is another example of a dining area in a church where we were staying. And the next slide also. We do provide meals. Breakfast and dinner are provided, usually at your lodging site, but sometimes if we have multiple sites, such as we have to do with COVID, we have to separate the beds a little bit more. And so therefore sometimes we utilize 2 different churches in that town, and you have to go from one church to the other church to eat. But we do provide breakfast, healthy breakfast, and healthy supper. Lunch is provided. You make your own sandwiches usually while you're waiting to get breakfast, and put it in a paper bag or a plastic Ziploc so they can be put in the cooler that goes out. There's water and Gatorade that usually goes out with that. And take that out with you in case there is any tornado or any bad weather where we would have to take cover. You need to be sure that you look at and find the designated areas without windows that you can curl up in to protect yourself. If you're out on a site, you might want to look around for a ditch or someplace where you can find safe cover. Be aware of exit doors where you're staying for safe exits in case of an emergency. Be aware where the fire extinguishers are in case the fire alarm goes off. And that has happened before at 2 a.m. in the morning with nothing going on. It just happened. Whether you're at base camp or where we stay on site, where you're working, pay close attention to your surroundings. Watch for things that may be a problem for you or your co-workers. Each call out and the job site have their own safety concerns. The next slide says behind the scenes, and this shows you some generators behind a shower trailer. And then behind the shower trailer you can see the gas tank. So those are hazards that could be a problem with the tripping, and also with the gas, possible gas leak or something. So be aware, use your nose, you smell gas, report it to someone. Watch where you're walking so that you don't trip and fall over any of the wires that are necessary to go out for drainage of water or electricity. when you're at a site, watch for hazards as well, because at your site, it's possible that you'll go in and find, like at one instance, the homeowner was burning a bunch of debris that they were taking out of the house or that was laying around in the yard. And then they started throwing in cans and bottles of stuff, and a can blew up. And when that can blew up, I stopped everybody and I said, look, you can't do this. You can't put any more of that stuff in this fire. You need to get it, burned down and put out. Because if it was a can and it blew up, pieces of metal could fly in the air. Not only that, but you have the fumes that we can breathe in and possibly cause a toxic problem for somebody. So watch out for those kinds of things. We need to try to prevent any kind of injury that we can. Pay attention to all the points that your teachers in the other classes are telling you if you go to chainsaw or mud out, because you're going to be using ladders and all kinds of equipment and saws and that kind of thing. The next slide shows slips, trips, and falls, the number one leading cause of injury in the U.S. Please don't use a ladder or any equipment that you have not had training in use. If you would like to know more about chainsaw safety, you can go to Stihl site and read or print out their safety guide. There's also another site for ladder safety. Using one in a safe manner can prevent falls and injuries. Louisville Ladder site is where you can go to find on their site the Climb Academy. And that's also a good thing to read through and make sure that you're using the ladder safely and that those feet of the ladder are firmly on the ground when you go up. Keep all of your equipment in good working order. Don't use tools that you do not know how to use. This is an example of what you will see when you come into a site many times. If they have already started taking their belongings out of their home, you will find it just out of the street side, and a lot of times that's where the garbage trucks will come along and scoop it all up. This is their personal property. Hopefully you aren't going to see people going through it because it's probably very contaminated stuff. It's not something that we should go through. We don't talk about it being trash. It's their personal belongings. It's their things they're being thrown out. And we need to remember that when we're talking with the residents of the homes. So you need to be aware of all of the things that you're going to be exposed to when you're in that kind of situation, including mold. Black mold is a greenish black and shiny when wet. Other colors may also be toxic or bacteria, which cause bacterial infections. Mold is powdery when dry, and this is when it travels. Sometimes we're in there after it dries, sometimes we're in there when part of it's dry and part of it's wet. And if you can't tell for sure what it is, you still need to be wearing all of the safety equipment that is on board in the trailers with your N95 masks and your, I call them hazmat suits, because that's what it looks like. Just know that if you're in flood recovery, that not only mold, but raw sewage has possibly been in that water that's been in that site, contaminated water, and all of the diseases that might be in that, and any other toxic or hazardous substances that's gotten into that water level when it came in. Know what to expect each day because the weather changes daily. Look around your job site and look for all of those hazards each and every day. And this is a site of one of the feeding units. And in the feeding units, you also have hazards that you don't have when you're out mudding or chainsawing. And that is because you're working with hot substances and hot equipment. You have more of a chance of a burn. And you have to be aware of your surroundings and where your next buddy is so that you don't turn around with something hot and run into them. Just be really careful in around the feeding areas. This is a picture of some of our team taking a break. And that's something that you have to do. You don't want to dehydrate and you don't want to overtire yourself. It's easy to do when you're out there. You see all the things that need to be done and you want to get it done and you're trying to hurry and get it done. Dehydration, thirst, dry mouth, headache, muscle cramps, dry, cool skin, dizziness, irritability, confusion, increased breathing, sleeplessness, increased heart rate, and fainting. These are all the kinds of things that you can have if you dehydrate or you overheat. So be sure and drink plenty of liquids. Water is best. You can add lemon or orange to the water if you have those fruits available. Sometimes we will have those fruits available when you're fixing your breakfast. It detoxifies and it has vitamin C for immune support and it has some potassium in it. You can also do the Gatorade. If you do Gatorade, I would suggest 2 waters to 1 Gatorade or every other time a Gatorade, just to keep that in your system so that you don't dehydrate and you don't deplete yourself of salt and potassium. Be your best, drink plenty of water, get 7 to 8 hours of sleep each night, cut out sugar to reduce inflammation, the silent killer, reduces joint pain, asthma, autoimmune diseases, cancer, heart disease, and so forth. It's very important to drink plenty of water. I would suggest even drinking water before you go out and then often through the day. If you see a buddy that's not stopping and taking a break, they're hot, they're sweaty, say, hey, come on, let's go get a drink. Let's go sit down for a minute under a shade tree if you can find one and get something out of the cooler to drink. The other thing that you need to be aware of is addressing the homeowner's needs. Keep the homeowner safe while you're working. Be aware that when they or other people are not on the team or around, that they are not familiar with how the team works. If mold is present, give the homeowner a copy of the CDC guidelines to help them aware of the hazards from the mold if you have a copy of that. Know when to wear your Tyvek suit, your mask, your respirators, and please do wear them. Communication with your team is very important. Keep them updated on issues and what to expect each day on each site. Be observant of coworkers and their stress levels. We get fatigued and we need to allow extra time, even at the end of the day, to clean up, because you don't want to be so exhausted that you can't get the tools all put back where they need to be and the equipment put away. Please don't be the man or woman and let someone know when you're not feeling well. Don't say, oh, I'm fine, because that's not a good thing. We found that out the hard way. Know your limit and be aware of when you are overdoing and exhausted. The other things that you need to be aware of is those surroundings where you might run across something, as like the next slide. This rattlesnake came up in the yard where we were working in a home after hurricane and flooding. And he was a pretty good sized little rattler, and I could hear him rattling inside by a window inside the house. Luckily, one of the local guys was out there. He picked up a big pipe and he got him right behind the head and killed him. But we were really quite watchful in the grass after that, because where there's one, there could be more. So you have to really be aware of that. The other thing you need to be sure and take with you, and we try to bring some extra, is sunscreen and bug spray. Those mosquitoes get pretty big out there when there's been a lot of water laying around. Again, this is a slide of a lift truck to get up in the trees to cut trees down. Do not use that. Do not get in it if you do not know how to use it and you have not been trained. And if you do get in it, please use your safety device and hook on that safety vest to your body and then onto the machine equipment like you're supposed to. The other thing we need to be aware of when we go out to these sites is when we get there, we need to find out for sure that the water is potable. If it's not potable, you don't need to drink it. You don't need to be brushing your teeth in it. You don't need to take your medicines with it. You drew water in a bottle. and there will be plenty of bottled water on sites. So you have to make sure that the water is safe to drink, because sometimes it's been contaminated after some of these disasters. The other thing you need to be aware of is dogs. Does a homeowner have a dog? Sometimes dogs are out running around because they have been scared or run away from their home during the storm or whatever has happened. You don't know how they're going to react to you in that situation. You need the food when you go out, but you also need to maintain your body temperature. If you exert yourself, your metabolism and your internal body temperatures increase. Water carries heat away from your internal organs before serious damage occurs, which can lead to heat stroke or even death. The heat travels through your bloodstream to your skin, causing you to sweat. As the sweat evaporates, it allows you to cool off. If the sweat is dehydrating you, then you need to start feeling thirsty. You've lost about 1% of your body water and are dehydrated. With a 2% water loss, you could experience serious fatigue and cardiovascular impairments. A lot of times if you get dehydrated, then you also get sick at your stomach and can possibly even throw up. So we don't want you to get to that point. If you get to that point, you may have to go in and get hydrated at the hospital, and we don't want to have to put you through that. So please take those breaks, drink the water, and be safe. Also be aware that if there's any electrical wires and water around, that could be a hazard, because you don't know if the power is on or off. That's another thing that you need to ask the homeowner about and find out. Unstable structures. We don't usually go into the mobile homes, because mobile homes, especially the single wides, once the floors have buckled and are not sturdy enough for us to walk on, or if you would happen to, they would want you to take the flooring up, you can't do that, because then the walls are liable to cave in on you. And we don't want you to fall through a floor. We don't want the walls caving in on you. Most of the times there is laundry service provided along with the showers. And if you get your clothing dirty, they can be washed there on site. I know our shower trailers, we do the showers and the laundry as well for the staff members, for the disaster relief people. Just need to bag it up, mark it with your name, and leave it off as you go out during the day. And during the day is usually the time that the people who are working the shower trailer can get that laundry done, and you'll be able to pick it up when you get back in at the evening time. Basic first aid. When you get your badge, we will be sending you this CPR, AED, and basic first aid book. We're not covering a lot of CPR and AED in this, and first aid in this course as such, because this book has a lot of really good detailed information in it. We advise you to take the CPR course, which includes use of the AED. And we also, on page 18, talks about the blood stop and putting a tourniquet on. We're going to hopefully in the future have a mini class that will be teaching some people how to use those kinds of things in case we would ever happen to need it. And there, it does talk about that there, but there again, if you're not trained in it, don't try to do it until you are trained in it. That the AEDs are on board to all of our trailers, and the laundry trailer also has it, as well as the IC trailer. And this video will tell you how to take care of it, and maintenance, and keeping track of the battery when it expires and the pads when they expire.
Regular maintenance and routine inspections will keep the Philips HeartStart on-site compliant and ready to rescue. The pads cartridge needs to be replaced every 2 years, and the battery needs to be replaced every 4 years. Each on-site cartridge contains one set of electrode AED pads and has the pull handle built in. Most of the time, there will be 2 sets of electrodes expiring at the same time for one AED. One set of electrodes is installed to the device, and the second one is safely stored on the left side of the red carrying case. Do not open the foil wrapper on the spare set. To begin replacement of the electrodes, take the on-site out of the case and remove the expired or about to expire cartridge of electrodes. To do this, locate the slide lever on the top of the AED. Pull from left to right, and the cartridge will pop out. Do not pull where it says pull. This is for emergency use only, and would expose the electrodes that would be applied to the patient. Now remove the one cartridge from the foil wrapper. Insert the new cartridge by putting it in bottom first at an angle, and then push down until you hear a snap. Once pads are inserted, the unit will give you a prompt.
Adult pads.
Return the AED to the case and ensure that you can see the green blinking light through the window. If you are only changing pads and have the green blink, then the device is once again ready to rescue and you can return it to the case. Now would be a great time to log in your inspection at aedauthority.com. You might also need to change the battery on the on-site. If this is the case, leave the AED out of the red carrying case. Turn over the AED. Release the tab to release the battery from the locked position and pull out. Please be sure to recycle the old battery at an appropriate recycling facility. Now put the new battery in, bottom first, and snap in. Note that the date on this battery is not an expiration date. This is an install by date. As long as this battery is installed to the AED before this date, then the battery is warranted for 4 years from the day it was installed. The AED will now run through a self-test that will include a series of steps. Be sure to follow these voice prompts. Do I press it now? No.
If the orange button is flashing, press it. Verified.
Wait approximately 60 seconds for the voice prompts to complete.
Testing.
Return the AED to the case and ensure that you can see the green blinking light through the window. The AED should now have a green blinking light, which is a fairly quick blink, so make sure you watch for a good 5 seconds to make sure you see it in the upper right-hand corner. The on-site performs a self-test every day and also when a new battery is installed. So if at any time when performing the routine monthly inspection there is not a quick green blinking light, and instead there is a solid light or no blink at all, press the blue I button. This will let you know what is wrong with the device.
No cartridge installed.
At this point, call your customer service representative of AED Authority for help in getting this taken care of immediately. Last but not least, remember to log your inspection at aedauthority.com in the concierge portal. Once you have completed all these steps, you can rest assured that your AED is ready to rescue.
The next video, it shows you how to use one. They're very easy to use. You open it up and it talks to you, and there's directions and pictures there. It makes it very simple to go through.
Sudden cardiac arrest is a leading cause of death. It can happen anywhere to anyone at any time. I'm here to demonstrate how to use the Philips HeartStart On-Site Automated External Defibrillator, or AED, in case you need to help someone in cardiac arrest. Set the AED on the same side of the patient as you. Press the on button.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
You have already called 911, so remove the clothing from the patient's chest as quickly as possible.
When patient's chest is bare, remove protective cover and take out white adhesive pads.
These are the electrode pads.
Look carefully at the pictures on the white adhesive pads. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. When the first pad is in place, look carefully at the picture on the second pad. Press pads firmly to patient's bare skin.
It doesn't matter which pad you put on first. The important thing is you place the pads exactly as shown in the picture and you press down firmly. As soon as the pads are in place, the AED will immediately start to evaluate the heart rhythm.
No one should touch the patient. Analyzing. Shock advised. Stay clear of patient.
Make sure no one is touching the patient.
Press the flashing orange button now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
Provide chest compressions and rescue breaths according to your training. Continue CPR until the AED tells you to stop, emergency medical personnel arrive, or the person starts moving. While you perform CPR, the AED will interrupt you at regular intervals so it can check if another shock is necessary.
Stop CPR. No one should touch the patient. Analyzing.
Keep standing clear of patient while the AED is evaluating the patient. It may decide to shock again, or it may say,
Shock not advised. It is safe to touch the patient. If needed, begin CPR.
even if they start to move or breathe normally, do not take the pads off the patient. The AED will keep monitoring the patient and will tell you if another shock is needed. That's it. Just do what the AED tells you from the moment you turn it on. When the emergency medical team arrives, you may have saved critical time by starting treatment. Even better, you may have saved a life.
And the next one is on the EpiPen, and if you've never dealt with an EpiPen, this will tell you a little bit about Epis and shows you how to use one.
A life-threatening allergic reaction, anaphylaxis,
is unpredictable. It could be mild 1 minute, then suddenly...
It's scary, like you can't even breathe scary.
Or your skin gets all itchy and breaks out into hives scary.
or your throat starts to tickle and close scary. It's different for everybody.
Every reaction is different. A mild reaction one time can be life-threatening the next. So it's important to know your body and know when it starts to feel funny. It could be the warning signs of anaphylaxis.
So it's also important to know how to use one of these.
An EpiPen auto-injector.
EpiPen and EpiPen Jr. are for the emergency treatment of life-threatening allergic reactions.
And for people who are at an increased risk for these reactions.
EpiPen and EpiPen Jr. should only be used to help someone during an emergency.
Ready to show them how it's done?
Yeah,
EpiPen Jr., the one with the green label, is for kids.
like me.
An EpiPen with the yellow label for bigger people, like me.
Whether you need to use EpiPen on yourself or give it to someone else, you can just follow these simple steps. So first things first, you take it out of the tube,
Just flip open the yellow cap,
or the green cap,
slide it out, and hold it like this.
Blue to the sky,
Orange to the thigh.
Then you take off the blue cap.
Blue safety release.
never put your hands near the orange tip because that's where the needle comes out.
The needle is designed to go through clothing, including jeans, because it must be injected into the outer thigh for quick absorption. If you're helping a young child,
Like me.
hold the leg firmly in place. Once it is,
You just do this.
Boom.
It clicks, so you know it worked. Then you hold it there for 3 seconds.
Then, remove EpiPen.
you'll still see some liquid in there, but don't worry, your EpiPen Jr. auto-injector gave you the right dose, and it has a special feature, the Never See needle.
Yeah, so the needle's totally covered up.
So you should never see the needle.
Then rub the spot for 10 seconds while you or someone else gets emergency medical help right away. Call an ambulance.
Or have someone take you to the emergency room. Just make sure to do it immediately.
And you should always carry 2 EpiPen auto-injectors wherever you go. They even come clipped together.
Because some people might need the second dose.
Take your expired or used EpiPen auto-injectors to your doctor's office and ask for a refill.
Remember, epinephrine is the only first-line treatment for anaphylaxis, not antihistamines.
So just trust yourself and do it. Don't hesitate, especially if you know the symptoms of a life-threatening allergic reaction and have practiced with the great trainer that comes in the box.
Because this is what's important to people like me.
And me.
Use EpiPen epinephrine injection USP 0.3 milligrams or EpiPen Junior epinephrine injection USP 0.15 milligrams auto-injectors right away when you have an allergic emergency, anaphylaxis. Get emergency medical help right away. You may need further medical attention. Only a healthcare professional should give additional doses of epinephrine if you need more than 2 injections for a single anaphylactic episode. EpiPen or EpiPen Junior should only be injected into the middle of your outer thigh, upper leg, through clothing if necessary. Do not inject into your veins, buttocks, fingers, toes, hands, or feet. Hold the leg of young children firmly in place before and during injection to prevent injuries. In case of accidental injection, please seek immediate medical treatment. Rarely, patients who have used EpiPen or EpiPen Junior may develop an infection at the injection site within a few days. Some of these infections can be serious. Call your healthcare professional right away if you have any of the following at an injection site: redness that does not go away, swelling, tenderness, or the area feels warm to the touch. Tell your healthcare professional about all of your medical conditions, especially if you have asthma, a history of depression, thyroid problems, Parkinson's disease, diabetes, high blood pressure or heart problems, have any other medical conditions, are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. Be sure to also tell your healthcare professional all the medicines you take, especially medicines for asthma. If you have certain medical conditions or take certain medicines, your condition may get worse or you may have longer-lasting side effects when you use EpiPen or EpiPen Junior. Common side effects include fast, irregular, or pounding heartbeat, sweating, nausea or vomiting, breathing problems, paleness, dizziness, weakness, shakiness, headache, feelings of overexcitement, nervousness, or anxiety. These side effects usually go away quickly if you lie down and rest. Tell your healthcare professional if you have any side effect that bothers you or that does not go away. Visit EpiPen.com for full prescribing information and patient information. EpiPen and EpiPen Junior auto-injectors are for the emergency treatment of life-threatening allergic reactions, anaphylaxis, caused by allergens, exercise, or unknown triggers, and for people who are at increased risk for these reactions. EpiPen and EpiPen Junior are intended for immediate administration as emergency supportive therapy only. Seek immediate emergency medical help right away. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For additional information, please contact us at 800-395-3376. Talk to your healthcare professional to see if EpiPen or EpiPen Junior auto-injectors are right for you.
So please be sure and feel free to ask questions if you have any. Be sure you read that booklet when you get it. I hope you have gotten something out of this. Thank you very much.